Care of the newborn 4. Take the newborn's axillary temperature every hour for the first 4 hours of life, every 4 hours for the remainder of the first 24 hours, and then every shift. Cold stress causes oxygen consumption and energy to be diverted from maintaining normal brain cell function and cardiac function, resulting in serious metabolic and physiological conditions. Cold stress causes oxygen consumption and energy to be diverted from maintaining normal brain cell function and cardiac function, resulting in serious metabolic and physiological conditions. Reflexes: sucking and rooting. Touch the newborn's lip, cheek, or corner of the mouth with a nipple. The newborn turns the head towards the nipple, opens the mouth, takes hold of the nipple, and sucks. Rooting reflex usually disappears after 3 to 4 months, but may persist for 1 year. Check for swallowing reflex. Swallowing reflex occurs spontaneously after sucking and obtaining fluids. Newborn swallows in coordination with sucking without gagging, coughing, or vomiting. Check for tonic neck and fencing. While the baby is falling asleep or sleeping, gently and quickly turn the head to one side. As the newborn faces the left side, the left arm and leg extend outward while the right arm and leg flex. When the head is turned to the right side, the right arm and leg extend outward while the left arm and leg flex. Response usually disappears within 3 to 4 months. Check for palmar plantar grasp. Place a finger in the palm of the newborn's hand and then place a finger at the base of the toes. The newborn's fingers curl around the examiner's fingers and the newborn's toes curl downward. Palmar response lessens within 3 to 4 months. Plantar response lessen within 8 months. Check for Moro reflex. Remember, Moro reflex. Hold the baby in a semi-sitting position and then allow the head and trunk to fall backward to at least 30-degree angle. The newborn assumes sharp extension and abduction of the arms with the thumbs and forefingers in a C position. This is followed by flexion and adduction to an embrace position. Legs follow a similar pattern. The Moro reflex is present at birth and is absent by 6 months of age if neurological maturation is not delayed. A body jerk motion may be the response between 8 and 18 weeks. A persistent response lasting more than 6 months may indicate a neurological abnormality. Check for startle reflex. The response is best elicited if the newborn is at least 24-hour old. The examiner makes a loud noise or claps hands to elicit the response. The newborn's arms adduct while the elbows flex. The hands stay clenched. The reflex should disappear within 4 months. Check for pull to sit response. Pull the newborn up by the wrist while the newborn is in the supine position. The head lags until the newborn is in an upright position, and then the head is level with the chest and shoulders momentarily before falling forward. The head then lifts for a few minutes. The response demands on the newborn's general muscle tone and condition on maturity level. Remember, check for Babinski response, also called plantar reflex. Beginning at the heel of the foot, use a finger to stroke gently upward along the lateral aspect of the sole and then move the finger along the ball of the foot. The newborn's toes hyperextend while the big toe dorsiflexes. Remember, the newborn toes hyperextend while the big toe dorsiflexes. The reflex disappears after the newborn is 1 year old. Absence of Babinski sign indicates the need for a neurological examination. Check for stepping or walking. Hold a newborn in a vertical position, allowing one foot to touch a stable surface. The newborn simulates walking. Alternately flexing and extending the feet. The reflex is usually present for 3 to 4 months. Check for crawling. Place the newborn on the abdomen. The newborn begins making crawling movements with arms and legs. The reflex usually disappears after about 6 weeks. Newborn safety. Here are the newborn safety. Newborn identification. Identification bracelets are applied to the mother and newborn immediately after birth and before the mother and the newborn are separated. In addition, identification pictures of the newborn and footprints from the newborn may be obtained before the newborn leaves and the mother's side in the delivery room. Identification bracelet for the father or whoever is there present with the mother. The bracelet include name, sex, date, time of birth, and identification numbers. Some agencies use identification bracelet that have radio frequency transmitter that set off alarms if the newborn is removed from a certain area. Agency also conduct unit and hospital-wide drills to prevent newborn abductions. Newborn abduction. The mother is taught to check the identification of any person who comes to remove the infant from her room and is taught other precautions to prevent newborn abduction. Nurses must be wearing photo identification or some other security badge all the time. Closed-circuit televisions, code alert bands, computer monitoring system, and other monitoring system may be used in some agencies. The newborn is wheeled in a bassinet, not carried in a staff member's arm. Parent teaching. Parent teaching, formula feeding. Teach sterilization techniques if the water supply is located in areas where the purification process of the water is questionable. Inform the mother that formula is a sufficient diet for the first 4 to 6 months. Assess the mother's ability to burp the newborn. Parent teaching for breastfeeding. Assess the newborn's ability to attach to the mother's breast and suck. Teach the mother how to pump her breast and how to store breast milk properly. Inform the mother that breast milk is a sufficient diet for the first 4 to 6 months. Give the mother the phone number of local organizations that offer support to breastfeeding mothers. Precautions to prevent infant abduction. All personnel must wear identification that is easily visible at all times. Teach parents to allow only hospital staff with proper identification to take their infant from them. Question anyone with a newborn near an exit or in an unusual part of the facility. Never leave a newborn unattended. Teach the parents that the newborn must be observed at all times. When the newborn is in the mother's room, position the crib away from the doorway. Teach the parents home safety precautions. Suggest that the parents Not place announcements in the paper or signs in their yard that might alert any abductor that a new infant is in the home. Newborns bathing. Bathe the newborn in a warm room before feeding. Make sure that his temperature is 98.2 and make sure the room temperature is 97 degrees. Have all equipment for bathing available. Use a mild soap, not on the face. Use a mild soap but not on the face. Proceed from the cleanest area to the dirtiest. Clean eyes from the inner canthus outward. Special care should be taken to clean under the folds of the neck, underarms, groin, and genitals. Make bath time enjoyable for the newborn and the mother. Clothing. Assess diaper and clothing needs for the newborn with the mother. Instruct the mother that the newborn's head should be covered in cold weather to prevent heat loss. Instruct the mother to layer the newborn's clothing in cooler weather. To be comfortable, the newborn should be dressed in one more layer of clothing than what the parents are wearing. Umbilical cord care. Same as before. Circumcision care. Same as before. Uncircumcised newborn. Inform the mother that the foreskin and glands are two similar layers of cells that separate from each other and that the separation process normally is complete by 3 years of age, although the layers can remain adhere until puberty. Instruct the mother not to pull back the foreskin, but to allow natural separation to occur. Inform the mother that as the process of separation occurs, slough cell build up between the layers of the foreskin and the glands, and that when retraction occurs, daily gentle washing of the gland with soap and water is sufficient to maintain adequate cleanliness. For preterm newborn is an infant born before 37 weeks of gestation. Primary concern relate to immaturity of all body system and organs. Assessment for a preterm newborn. Respirations are irregular with periods of apnea. Body temperature is below normal. The newborn has poor suck and swallow reflexes. Bowel sounds are diminished. Urinary output is either increased or decreased. Extremities are thin with minimal creasing on soles and palms. The newborn extends extremities and does not maintain flexion. Lanugo on skin and in the hair on the newborn's head is present in woolly patches. Skin is thin with visible blood vessels and minimal subcutaneous fat pads. Skin may appear jaundiced. Testes are undescended in boys. Labia are narrow in girls. Intervention for preterm newborn. Monitor vital signs every 2 to 4 hours. Maintain airway and cardiopulmonary functions. Administer oxygen and humidification as prescribed. Monitor intake and output and electrolyte balance. Monitor daily weight. Maintain the newborn in a warming device. Avoid exposure to infections. Provide the newborn with appropriate stimulations such as touch and cuddling and rubbing of the back. Remember, for preterm newborn, primary concern relates to immaturity of all body system and organs. It is an infant born before 37 weeks of gestation.